Welcome to The Scoop, NANP's monthly educational webinar series. I am your host, Andrea Granson, Education Program Specialist for the NANP. These webinars are recorded and can be viewed at any time by logging into the NANP members area. Okay, let's get started. Today we present Functional Blood Chemistry Analysis Optimal Ranges presented by Dr. Cindy Ross. Dr. Cindy is a functional medicine practitioner. She uses functional medicine to help find answers to the cause of illness along with nutritional imbalances. Dr. Cindy completed her medical degree in natural medicine from the University of Natural Medicine, where she also completed her PhD in health sciences. She received her master's degree in nutrition from the American College of Healthcare Sciences. Dr. Cindy received her Bachelor's of Science degree in Exercise Science from the University of South Alabama. Dr. Cindy's legacy project is a non-profit created in 2016 called CHAD. She uses her education to provide humanitarian work of functional medicine along with nutrition counseling in underprivileged communities worldwide. Dr. Cindy also has a chapter of Not Just Tourists in Orange Beach, providing medical supplies in developing countries. Welcome, Dr. Cindy. Thank you for joining us today. It's now over to you.
Thank you so much for having me. I am so excited to be here. I'm always excited to share my passion with functional blood chemistry analysis. So as Andrea said, I am Dr. Cindy Ross. I started studying blood work and using blood chemistry analysis in my practice a couple years ago. I am triple board certified now in holistic nutrition with NANP as well as the certified dietary supplement professional. I was the very first one for that, so I am excited to announce that. And then just recently, I got board certified in regenerative medicine through A4M this past December. So functional blood chemistry analysis, it is the ultimate tool that I use in my practice when I'm assessing clients, because it can help us to identify patterns of imbalances before a client gets diagnosed with a full-blown disease by getting to the root cause of symptoms. So why is functional blood chemistry analysis and the difference it can make to your health? Not only can it make a big difference in diagnosing disease, but it also can influence prevention. One of my favorite quotes that I always go by is that your genes hold the gun and your lifestyle pulls the trigger. Okay, so we're going to start off, we're going to dive deep into this. So staying in optimal ranges. I'm really excited to be able to share this body of work with all of my fellow NANP members. I feel that blood chemistry analysis is such an important tool to what we are doing in functional medicine, and especially in our functional medicine community. Some of the basic principles that we are looking at when we are evaluating a client and looking at their blood work is we're looking at reducing inflammation and oxidation. We're looking to improve nutrition levels. We're looking to minimize toxicity, we're looking to minimize stress, and we're looking to improve diet and lifestyle. So I'm sure that as you're working with your clients, and I hear this all the time, and I'm sure you have as well, the number one thing that I hear most every day is, I just don't feel good, but my general practitioner said my labs are normal. Has this happened to you? It happens to me every single day. So I want to start with conventional versus functional ranges. So functional blood chemistry analysis, it's vastly different from conventional lab work. First, the conventional blood chemistry analysis compiles its normal ranges from a small group of patients, most of whom are moderately to severely ill. This means that when your patient's results fall in, and I'm sorry, I say patients because I do practice as a doctor, but I know as we are the NANP members, we say clients. So I want to verify that. So this means that when your client's results fall within normal ranges, they are really just average among a group of already sick people. By contrast, functional blood chemistry analysis uses data from healthy, functional people to create its normal ranges. Functionally, normal ranges are much more narrow than their conventional counterparts, easily detecting patterns of imbalance. So let's go through this. Conventional, it's based on general health of the population. Functional, it's based on historical research of healthy people. Conventional, normal results, even though the patient is experiencing symptoms. Functional ranges are narrow and helping to develop disease patterns for imbalances. Okay, so non-specific for underlying causes of sickness is conventional, and functional is imbalances are found based on functional optimal ranges. Conventional, no precautionary markers are indicated. Functional, disease patterns are often found in blood chemistry early, preventing full-blown disease. So first and foremost, the common lab test that we run is a CBC. The CBC, it shows 3 types of blood cells: red blood cells, white blood cells, and platelets. The red blood cell markers are your hemoglobin, your hematocrit, your MCV, which measures the average size of your red blood cells, your MCH, which is the average amount in each of your red blood cells, is a protein called hemoglobin, which carries oxygen around your body. Then you have your MCHC, which checks the average amount of hemoglobin in a group of red blood cells. Last, you have the RDW, which is your red blood cell distribution width. This is the variation of the size volume of your red blood cells. And then we're going to check for white blood cells, and they are broken down into your neutrophils, lymphocytes, eosinophils, monocytes, and basophils. All right, hopefully you guys are following along. It's a lot of information, and we are just pretty much outlining what all the functional blood chemistry analysis looks into. But hopefully at the end of this, you will get the gist, and I will intrigue you to want to find out more about this. So let's look at the evaluation of red blood cells. So when you're looking at your red blood cells, we're looking at hydration, anemias. A lot of time as well, it can be coming from menstrual or occult bleeding, vital nutrients. Hemoglobin, same, hydration, anemias, menstrual, occult bleeding, vital nutrients. Same with the hematocrit. So let's drop on down to your MCVs, MCH, MCHC. Those are all looking for anemias. A lot of deficiencies for vitamin B12, folate. I'm looking at these when I have a client in my office. This is the first thing that I'm looking for to see if my client is nutrient deficient. A lot of times they will be lower, and you will be able to see a pattern in these 3 biomarkers. And then you have your RDW, which is the blood loss supplementation needed folate and B12 and iron. So you're going to be a deficient in that as well. So you will definitely see a pattern. If you suspect that your patient is anemic, you will see a definite pattern with 2 to 4 of these biomarkers. And let's look at the evaluation of white blood cells. So white blood cells, you're looking at bone marrow deficiency, chronic or active infection, absorption issues with food, need for better dietary habits. I just had a couple of clients this past week. Their white blood cells were really low, and then they proceeded to tell me that they were getting in between probably 700 to 1,000 calories a day. So they definitely needed better dietary habits. A lot of times as well, like if you're seeing a patient that possibly has an eating disorder, you're going to see a depleted white blood cell count. Neutrophils, inflammation, GI issues, need for B12, acute or chronic infections. Eosinophils, I see this one all the time. So this is your eosinophils and your basophils are going to be 2 of your markers that you're going to look at for intestinal parasites and food allergies. So right off, if these are elevated, you know that you're going to need further testing either with an IgG food panel or a stool test. One of the questions I always ask is, how are the bowel movements? Explosive diarrhea, constipation. That is going to indicate intestinal parasite, and they're very common. I treat them all the time. So remember, these are going to be your friends as far as looking at on blood work. And a lot of times they are missed with the regular MDs. MDs are giving them just medicines to fix their symptoms, which, could be the diarrhea or the constipation, and they're not looking at parasites. And a lot of times when you see the elevated eosinophils and the basophils, you're also going to see the same markers showing anemia. It's very common to be anemic, be very low in iron when you have the intestinal parasite. Lymphocytes, viral infection, detoxification pathway support, inflammation, bone marrow insufficiency, monocytes, past or current infection. I'm seeing a lot of elevated monocytes right now with post-COVID. The monocytes are pulling up the dead virals. So it looks like they have an ongoing chronic infection when they come into my office, and then I'll ask the client, have you been sick lately? And then they'll proceed to tell me that they had COVID, possibly, anywhere between 8 and 12 weeks ago. So definitely look for that. Also, your monocytes can be elevated if you have an intestinal parasite or poor liver function as well. Platelets, viral, bacterial infection, elevated levels of B12, and possible endothelial damage or inflammation. And this is just bacterial versus viral. Bacterial infection, acute, is neutrophils are going to be greater than 60%. Lymphocytes are going to be less than 24%. Monocytes are going to be greater than 7. And white blood cells are going to be greater than 7.5. On the viral side, the neutrophils are going to be less than 40%. Lymphocytes are going to be greater than 44%. Monocytes are going to be greater than 7. White blood cells are going to be greater than 7.5. For the bacterial infection on the chronic side, neutrophils are going to be greater than 60%. Lymphocytes will be less than 24%. Monocytes will probably be normal. And then your white blood cells are going to be less than 5.5. On the viral infection side of the chronic is going to be the neutrophils are going to be less than 40%. Lymphocytes will be less than 24%. Monocytes most likely will be normal, and white blood cells will be less than 5.5. And then this is an evaluation of iron markers. So total iron, it measures the dissolved iron in the blood. And then you have the transferrin, which binds iron and transports to the liver, spleen, and bone marrow. Ferritin is your cellular storage protein for iron. Total iron binding capacity, which is your TIBC, which that's how it reads usually on your labs. It's going to be the transferrin is primary protein, which transports iron through the blood. Unsaturated iron binding capacity, which is your UIBC, is unsaturated amount of transferrin. And then you got your percentage of transferrin saturation. And it's a calculated value, serum times 100 of your total iron binding capacity. So anytime that you see total iron, alarm range is going to be less than 25 or greater than 200. Eliminate the possibility of internal bleeding, increase iron dense food intake, promote sufficient hydrochloric acid for the absorption of nutrients. So the hydrochloric acid, usually they will have hypochlorhydria, which is the low production of good stomach acid. So their body's not able to absorb the nutrients correctly. If I suspect that there is internal bleeding going on, I immediately refer them out to a GI doctor or to a hematologist. Do not mess around with that. I mean, we are not treating here. We are simply trying to get to the root cause of what they have going on. So if you do suspect internal bleeding, definitely get them referred out as soon as possible. Transferrin, rule out heavy metal burden from cookware, water, promote a diet high in proteins and fats with complex carbohydrates, and also investigate inflammation possibilities. So your transferrin, yes, it is in your iron markers, but it is a great indicator for inflammation. So if your ESR, which is your SED rate, if it's elevated, and then your CRP, if those are all elevated, then you're going to see a pattern of inflammation. So more than likely, all of their other iron markers will be fine, but their transferrin is going to be high. Also, ferritin alarm range is going to be less than 8 or greater than 322. Iron deficient anemia is probable. Investigate inflammation possibilities. Myself, I have rheumatoid arthritis, and my ferritin level through the years, it goes up and down, but it has been greater than 500 before. So, and that's when I was having a flare. So definitely investigate inflammation, and then rule out environmental heavy burden from cookware or water as well. The oats test is always great if you suspect a heavy metal burden. The oats test, if you're not familiar with it, Great Plains Laboratory, they do a great job on testing for that with like 77 markers. And it's a great way to really dial in to see what exactly is projecting what their symptoms are. Their TIBC, rule out environmental heavy burden from cookware, evaluation of hemochromatosis, investigate inflammation or infection, promote sufficient hydrochloric acid for the absorption of nutrients. So as you can see, a lot of these are redundant, and this is what you'll see in the blood work. It becomes a pattern. Your UIBC, the same, rule out heavy metal burden, evaluation for hemochromatosis, investigate inflammation, and also eliminate the possibility for internal bleeding, and as well as your percentage for transferrin saturation, the same. Promote sufficient hydrochloric acid as well. And again, that is your hypochlorhydria, which is the low production of good stomach acid. So you have to make sure that they are getting enough good stomach acid to break down the nutrients and vitamins that their bodies need. And a lot of times with that, you'll also see a pattern for muscle atrophy. So, and that's because their bodies aren't breaking down the things that they need. Okay, so comprehensive metabolic panel, that is going to be the next panel that you're going to run. This test is made up of 14 biomarkers plus the calculated marker Anion gap. And unfortunately, in conventional medicine, many of the physicians will remove some of these biomarkers to meet insurance standards, to save the patient money. So they're not running everything that they need to really get the entire story. And that's what our jobs are. We want to get the entire story. It's the only way to see what's going on. You have to remember your body is one system. So when one thing gets off, it's going to cause everything else to get off. A lot of times in conventional medicine, they are treating each symptom as its own thing, and they're not looking beyond that compartment. These biomarkers are really important to gain sight on inflammation, organ dysfunction, vitamin status, mineral status, and much more. So in this comprehensive metabolic panel, you're going to be running a bun, glucose, chloride, alkaline phosphatase, total bilirubin, total protein, albumin, your AST, your ALT, which are your liver enzymes, carbon dioxide, creatinine, sodium, and then of course your anion gap. And then you, on these, you can be looking at dysfunctions. Your glucose, optimal ranges are 75 to 86. Insulin resistance, when you see this off, it's going to be diabetes, thiamine deficiency, hypoglycemia, metabolic syndrome. And then I put in here what I use with my patients. So I use berberine, cinnamon, chromium. I put them on a low glycemic diet, and of course, exercise. Calcium, optimal ranges are 9.2 to 10.0. Hypertension, constipation, heart palpitations, insomnia, anxiety, muscle cramps. And then management would be diet rich in calcium, adequate hydrochloric acid production, vitamin D, magnesium. Sodium, optimal ranges are 135 to 142. Dysfunctions can be dehydration, adrenal stress, edema, renal insufficiency, Addison's disease, adrenal exhaustion. And then management would be to put them on an adrenal gland support, support their kidney dysfunction, and evaluate for excessive sweating. Chloride, optimal ranges are 100 to 106. And again, dysfunctions can be hypochlorhydria, dehydration, adrenal exhaustion, metabolic alkalosis. And management would be to make sure that they're producing enough good, adequate acid, high hydrochloric acid production, rule out any excess of sweating, vomiting, or diarrhea, and then also support their adrenal function. And if you notice, a lot comes up with this hydrochloric acid, which is the hypochlorhydria. I see, because it stems from bad gut health, I see it probably in 8 out of 10 of my clients. And they're producing the low good stomach acid, which is called hypochlorhydria. So you will learn a lot about this as you dive deep into blood chemistry analysis. You'll notice it pretty much with all patients, because again, most of your patients' clients will have bad gut health. So that's what we have to address. Potassium. Optimum ranges are 4.0 to 4.5. And dysfunctions could include adrenal exhaustion, cell damage, hypertension, metabolic acidosis, nutrient deficiency. Management would include reduction of stress through lifestyle changes, decrease inflammation, supplementation, and hydration. And also, you have to take into consideration that when you send your clients for blood work, I always have mine fasted 10 to 12 hours prior to blood work. And I do tell them to drink, because most of the time I do run a urinalysis as well. So I want to make sure that they are producing enough urine to do the urinalysis. But it seems a lot of times they will show a few dehydration markers. So I wouldn't look too much into that unless you're seeing a huge pattern. Carbon dioxide optimal ranges are 25 through 30. Dysfunctions include thiamine deficiency, which is your B1 vitamin, hypochlorhydria, metabolic alkalosis, and metabolic acidosis. Management includes supplement with thiamine, stress reduction with lifestyle, adequate hydrochloric acid production. Also, something that I see a lot of, and I always like to share this, is I see a huge thiamine deficiency. Thiamine deficiency really includes a lot with your cognitive function as well. So we want to make sure that we are supplementing if you are seeing a thiamine deficiency, to make sure that you are supplementing with B1. It will make your client feel better, and that the brain fog will start disappearing, and they're just going to overall have better general health. The BUN optimal ranges are 10 to 16. Dysfunctions include edema, malabsorption, low dietary intake, hypochlorhydria, dysbiosis, and liver dysfunction. Management includes hydration, stress reduction with lifestyle changes, a balanced diet, and make sure to rule out any kidney dysfunction as well. A lot of times when I see an elevated BUN, I'm also looking at their EGFRs, your non-African American, and your African American. If those are showing some dysfunction, and which means that they're showing on the lower side of optimal, and you got a high BUN, then I possibly would refer them out to a kidney specialist. And your creatinine is a 0.8 to 1.1 for optimal ranges. Dysfunctions include renal dysfunction, cardiovascular disease, muscular degenerative diseases, prostatitis, dehydration, exercise overload. Management includes evaluation of kidney health, investigate physical activity, hydration, and inquire about supplementation of creatine. Alkaline phosphatase optimal ranges are 70 to 100. Dysfunctions include zinc deficiency, hypochlorhydria, shingles, vitamin and mineral deficiencies, and intestinal hyperpermeability. Make sure that you are management with adequate hydrochloric acid production, supplementation, rule out any bowel obstruction, and liver support. So now we go to your liver enzymes, which is your AST and your ALT. Ranges for both are 10 to 26. Your AST is going to be your more acute, which is also checked for a heart attack. If a heart attack's been present, they will also check the AST to see if it's elevated. Dysfunctions include vitamin B deficiency, malabsorption, alcoholism, heart attack, liver dysfunction, dysfunctions outside the liver, and then that, which means like another organ that's causing it to be elevated. Congestive heart disease as well. Management would be adequate hydrochloric acid production, make sure to elevate tissue damage outside of the liver, stress reduction with lifestyle changes, and liver support. If I see an elevated AST and ALT, immediately I'm putting my patients on milk thistle. I see great benefits with it, and it seems to get all of their levels back down into optimal ranges. For the ALT, which is your more chronic, this one's going to show fatty liver, cirrhosis of the liver, hepatitis, alcoholism, exercise overload. And this dysfunction is inside the liver, where your AST was outside the liver. And just on this one, for the management, evaluate diet to support liver function, control blood glucose levels, and make sure that they're producing enough hydrochloric acid. Bilirubin, 0.3 to 0.9. Dysfunctions include spleen dysfunction, oxidative stress, biliary obstruction, liver dysfunction, Gilbert syndrome. And management would include dietary support for optimum bowel flow, supplementation support for optimal spleen health. If I see this one and it's elevated, I'm asking about gallbladders. You want to make sure that, if you know whether it's been removed or if they still have it, if they're going to the bathroom on a regular basis, make sure that there's no constipation, and just rule out. And again, if you feel like there is an obstruction, I would refer them out to a GI doctor. And then total protein, 6.9 to 7.4. We're looking at dysfunctions such as dehydration, rheumatoid arthritis, GI dysfunction, absorption issues, and liver dysfunction. If you see that total protein depleted, you know that they have some absorption issues. And then management would include diet high in protein, ensure adequate hydrochloric acid production. And your anion gap on the last one of the 14, the 15 markers is 7. The optimal ranges are 7 to 12. And then dysfunctions can include a thiamine deficiency, metabolic acidosis, multiple myeloma, and metal toxicity. And then management would be a diet rich in leafy green vegetables. Whew, that was a mouthful. Are you keeping up with me? I hope you are. Okay, so this one would be optional biomarkers to be considered. And of course, your general medical doctors they're not running a lot of these. Just because it's out of the insurance standard needs. So one of the main differences between functional blood chemistry analysis and conventional lab tests is the ability to look at patterns of markers rather than isolated tests. So that's where your MDs are looking. They're looking at mostly the isolated tests. They're not looking at any patterns. That's where we come in at. So I'm going to use the thyroid panel as an example. So if I notice a thyroid stimulating hormone is high, which is your TSH, which that's normally ran in your actually where it's made up of the 14 biomarkers. Okay. So that's going to be in your metabolic panel. When that one is high, low, or even normal, it tells me very little about what is actually going on with the thyroid. Conversion of T4 hormone into T3, how your body is clearing reverse T3, if you have active antibodies, if any thyroid hormone receptor sites are blocked and not receiving the natural hormone well, then that's the pattern that we're looking for. So TSH alone is not a good indicator of a bad thyroid. TSH is produced actually by the pituitary gland, not the thyroid. So measuring the TSH gives me a piece of the puzzle, but it's not the entire picture. So that's why it's really important to consider additional biomarkers when running their blood labs. So I use Avexia to run my blood labs. They are fantastic. I get really great pricing. I'm happy to share that information with you if you want to contact me after the webinar. If you have questions, I can answer for you, but I use them and they have, they're integrated. I use ODX as well. And they have ODX panels and they have Avexia panels, and they're called wellness panels. You got basic wellness, comprehensive wellness panels. And I usually do a comprehensive in my package. I do a comprehensive because I really do like to pull every biomarker that I can to get the full picture. And most of your clients will be willing to do it because they're ready to get answers. They don't feel good. They know that by going to the regular general practitioner, their labs are normal and they're not getting any answers. So they're going to be more than open for you testing additional biomarkers. And you get great pricing with Avexia. So I think that you'll be pleasantly surprised with them. And there's a couple others that I can recommend as well if you don't go through Avexia. But that's personally who I use. And I'm able to pull all of these biomarkers. So literally when I pull their blood work, they laugh at me. My clients say, I feel like I just donated blood, because usually it's about a 7 to 8 vials that they're pulling. Plus I do a urinalysis, and it's going to give me about a 8-page of their regular lab report. And then once I do a blood chemistry analysis, we're looking at like 80 to 85 pages of really great information, digging deep into what's going on with their symptoms. Okay, so these are the individual biomarker optimal ranges, and I won't go through all of these. I'll make sure that the slide stays up for a second. I'll hit on it. So the hemoglobin A1C, of course, that's looking at your blood glucose over a range. Your fibrinogen, it's a great indicator for inflammation. Your GGT is it's another great liver enzyme to check. Like if you suspect any liver dysfunction, such as fatty liver or cirrhosis, I would check the GGT. Your phosphorus, it's a great one to indicate if there's any hypochlorhydria or kidney dysfunction going on. Also parathyroid hyperfunction. Uric acid is another great one for inflammation, rheumatoid arthritis. Your EGFRs is what I mentioned earlier for kidney dysfunction. You're going to have your EGFR non-African American and African American markers. And then you got your ASCRP, which is an inflammation marker, which we talked about earlier. If you see a pattern with your ferritin and transferrin, and then of course also your uric acid, and as well as this one, you're going to see a pattern of inflammation. If they tell you that their joints are hurting them and that they just feel really bad every day, they have some major inflammation. And just remember, the inflammation comes from the gut. So once they get leaky gut and those toxins are going into their bloodstream, the place that we have the most space at is within our joints. So that's where the toxins are going to sit. It's going to cause them inflammation. So that's what you need to be looking at if you suspect any gut dysbiosis. LDH is another anemia marker that I love to check. Magnesium, of course, is great for absorption issues. If you're checking, if you suspect there's absorption issues, I would definitely check magnesium. It can affect, if they're low in magnesium, it can also affect their kidneys, their thyroid, and their glucose levels. I don't check methylmalonic acid too much because I usually see the pattern before that. The homocysteine is one of my favorites, also just for general health, just overall, just not feeling well. And then it's also a marker for heart disease. Albumin, sometimes it can be elevated because of dehydration. So just remember that if you do have them fasted, this one could be elevated. Also low production of hydrochloric acid, which causes the hypochlorhydria, and then thyroid dysfunction as well. Globulin, immune dysfunction, oxidative stress, dysbiosis, inflammation. Let's see. All right, diseases related to vitamin D deficiencies. And I want to make sure that we're not running out of time. And I know it's a lot of material that we're covering in a short amount of time, but hopefully you, if you have any questions, you will definitely let me know. All right, so I see so many of my patients with low vitamin D. I would probably say 9 out of 10 come in with reduced vitamin D levels. I see it in a lot of my obese clients, the elderly population, people that use too much sunscreen, lack of sunlight. We're all guilty of that, sitting behind our computers too much, and then also darker skin color. And the effects of low vitamin D can include, but not limited to, increased oxidative stress, reduced cognitive function, which is the brain fog. I get told pretty much every day by most of my clients that they have brain fog, especially after COVID. Infections also can be more frequent with low vitamin D. Autoimmune diseases, you're more prone to them. Colorectal cancers, of course, nutrient imbalances, and the list goes on. As you can see here, rickets, osteoporosis, depression, anxiety, colon cancer, schizophrenia, dementia, diabetes, prostate cancer, erectile dysfunction, heart disease, breast cancer. Vitamin D, I literally make sure that everybody has a really nice, healthy, optimal vitamin D level. It's just going to make them feel overall better. And then as we talked about earlier, your thyroid. So you have your TSH, your T4, your T3, your T3 uptake, T3 reverse. TSH test is the most accurate way to diagnose a thyroid disorder. That's when your MDs are saying, okay, we might need to start taking a medicine for your thyroid. Then when I see a TSH, and even if it's normal, I'm checking every blood work that I run, I'm checking T4, T3, T3 uptake, and T3 reverse. Again, it's the only way to see the entire picture, and it's the best way to see exactly what's going on with your client. And then we have your lipid panel as well. So I see so many patients that come into my office, and they're coming in on statins, and their cholesterol markers are tanked. So yes, the statins are doing their job by lowering the LDL, but at the same time, they are also lowering their HDL, which is their healthy cholesterol. You need cholesterol. You need cholesterol for brain health, absorption of vitamins and minerals, hormones, cell structure, tissue repair, and then you must investigate any underlying issues of higher normal cholesterol. You really want to check everything. I check total cholesterol, low density lipoprotein, which is your LDL, high density lipoprotein, which is your HDL, triglycerides, very low density lipoprotein, which is your VLDL, your cholesterol HDL ratio. I know that says ration. It should say ratio. I will get that corrected for you. Your ApoB and your lipoprotein A. Many times, the MDs are not checking the lipoprotein A because there is no medication for it. But I check it with most every one of my clients because it can be a widowmaker. It is a genetic marker that you're either born with or you're not. It puts you at a 200% risk for a heart attack or stroke, especially if your LDL is not controlled. And you got to remember, your cholesterol, it is driven by carbohydrates and sugar. So this is why we really want to promote an anti-inflammatory diet, low glycemic diet with our clients that are showing a high LDL, that are showing a positive LPA, because we want to keep that inflammation down in the body. And again, anytime that your intake of a lot of carbohydrates and your sugars, it's also going to increase your glucose levels, which in turn will make you insulin resistant. And that's when the client starts holding more weight around their middle, and you'll start seeing a pattern. So I love this quote by Peter Attia. The true reason for atherosclerosis is the presence of a sterol in an artery wall. How it gets there is the only thing to worry about. So we must investigate how their cholesterol is so high, why their cholesterol is so high. And if their HDL is low, they're more prone to cancers. They're more prone to brain health issues. So we really want to make sure that their HDL is nice and healthy. I usually tell my clients 1 teaspoon of liquid coconut oil a day. Make sure they're getting enough monounsaturated fatty acids in, which include your avocados, almonds, olive oil, etc. And then here's your optimal markers and dysfunctions for cholesterol. So triglycerides, optimal range would be 70 to 80. Cholesterol, optimal range is 180 to 220. LDL is less than 120. And then HDL is greater than 55. I usually like to see that HDL number around 70. And you got to remember, the LDL is considered the bad cholesterol, but we need the cholesterol. I mean, that's where our hormones are made. That's where everything comes from. So, and then if their HDL is really high and you're showing high liver enzymes as well, we might want to look at fatty liver, and usually you'll see that HDL super high as well. So that's another pattern that you can look at. And then hormones and imbalances. We have our estrogens, testosterone, DHEA, progesterone, and then SHBG, sex hormone binding globulin. So your estrogen, you got your estradiol, estrone, estriol. Dysfunctions can include weight gain, mood swings, night sweats, fatigue. Testosterone, total and free, abnormal hair growth, reduced libido, high blood pressure, acne. DHEA, erectile dysfunction, deepening of the voice, thinning of vaginal tissues in women, decreased sex drive, increased facial hair. Progesterone, during ovulation, progesterone increases. It is beneficial for the prostate. It is important for the brain. Imbalance leads to heart disease and cancer. It improves cholesterol levels. And then your SHBG, infertility, excessive body hair, breast growth, impotence, and voice deepening. Okay. So if you're ready to dive into functional blood chemistry analysis, I just finished producing the course for American College of Healthcare Sciences, and it is actually launching this month in the month of March. So make sure to check out their website for more information and get enrolled. Their website is www.achs.edu. And I know that they're a big part of NANP. So I'm super excited to be teaching this class. And I hope that I have intrigued you to want to learn more about the disease patterns, what to look for, nutrient, vitamin deficiencies. I can tell you I am so passionate about this, and it is the core and heart of my practice. And I love to be able to share it with all of you. This is my contact information. You can find me, my practice is called Life Wellness Forever. And of course, you can find me by searching Dr. Cindy Ross. I'm on pretty much all social media, Facebook, Twitter, Instagram, Pinterest, LinkedIn. I'm there. I would love for you to follow me. And if you have any questions, please feel free to reach out. My email address is drcindy@lifewellnessforever.com. And I'm going to hand it back over to Andrea if you guys have any questions.
That was awesome, Cindy. Thank you so much. I love the distinction between conventional and functional lab testing, because, of course, this is where we can come in with our nutritional knowledge and our sort of lifestyle practices. That really was excellent. I know that our members are going to get a lot of value from this. This is, of course, one of the foundational things that we need to do once we've graduated from school, and to take our practice to the next level. So I want to thank everybody for listening and joining us today, and to remind everyone that this presentation can be viewed in the NANP members area, along with a vast selection of cutting-edge webinars. As mentioned, each webinar includes a corresponding quiz, which is worth 1 continuing education credit. So, do you have an interesting topic that you would like to present? Or do you know any speakers that you would like us to host? If so, please feel free to reach out to me by emailing me at andrea@namp.org. So this brings us to the end of our discussion. Thank you, Dr. Cindy Ross, and thank you everybody for listening.
Thank you.
Thank you. Bye for now.